guest for you guys today. Talk about healthcare. It's Thom Hartmann. He's the host of the Thom Hartmann program. That's on Sirius XM. It's on radio stations across the country. It's on Free Speech TV. But he's also a New York Times bestselling author, and his new book is called The Hidden History of American Healthcare. Thom, welcome back to the show, brother.
Hey, Cenk, it's great to be here with you, and it's so nice to see you again.
It's great to see you, man. All right, so Thom, let's talk history as we often do. Most of the developed nations have single-payer healthcare, so what that means is public health insurance, right? Now, some go beyond that, the UK does, et cetera, but we don't. Why did we diverge from everyone else? How did that happen?
It really began in the 1880s, 1890s, when medicine became a thing. And there was this guy named Frederick Ludwig Hoffmann who came over here from Germany, and he was a young man. He was 17, in fact, when he came over, and was a numbers genius. And he hooked up with the Prudential Life Insurance Company, ended up being a vice president. And he was the guy who figured out that there was an association, a statistical association between working in a cotton mill and having lung problems, asbestos and mesothelioma, smoking and lung cancer. He published on that in the 1910s, in the 1890s and 1910s, and diet and cancer. In fact, his book on the association between a high processed food diet and cancer is still in print. He's been dead since 1946, but his book is still around. So he's really smart in these things. And so he married this Southern belle from Georgia who was from a racist plantation family. And so he ran the numbers on black people and found that black people were dying, dropping like flies, more likely to be sick, more likely to die of pretty much everything. And concluded, which was the general consensus at the time among a lot of white people in the South, this is again in the 1890s, that black people were genetically inferior. And in 1896, he published a book called Race, Tendencies, and Traits of the American Negro, in which he lays out all the numbers, and then he concludes that if we simply avoided allowing black people to have any access to health care, that within 2 or 3 generations, the whole race would die out, and that would solve the race problem in America. Now, it sounds kind of crazy when I just lay it out like that right now, but this led to a whole bunch of things. By the 1920s, this was referred to as scientific racism. He was testifying about it before Congress. When Teddy Roosevelt, 1912, proposed a national healthcare system, people said no because black people will get it. When Franklin Roosevelt proposed a national healthcare system, it was the same thing. We don't want black people to get it. When Truman tried it in 47, same thing. Don't want black people to get it. Right up until 1965, Senator Stennis, the Dixiecrats in the South, was quoting Hoffman, who was by then dead, but is still very famous in this field, as saying this. We have to figure out a way to keep black people from using Medicare. This is when they were passing Medicare. And the way that they came up with was to have a 20% hole, a gap in Medicare, so that you had to pay 20% of your doctor's bill and your hospital bill. And that would discourage poor black people from showing up at the hospitals. I mean, it was the most shocking thing I discovered, Cenk, when I was doing the research on this book, is that nearly 100% of the reason why the United States is the only country in the world that doesn't define healthcare as a right and doesn't have any sort of national healthcare system to speak of is because of racism.
That's amazing. I love when you find hidden histories.
And that's why you've got 12 states that still haven't expanded Medicaid, right? Free health insurance for low income people, all former slave states.